Yay, that worked that time. What's up, everybody? Welcome to the webinar. I had to hit that go live button to let you in like a couple of times because they're still doing road construction 30 feet from my house. Bless it. And it has had one heck of an impact on my ability to run the webinar superhighway or internet superhighway smoothly lately. But I am super excited about today's webinar, and today's presenter is my dear friend, Dr. Michael Bagnell. And I'm super sad for y'all that y'all don't get to meet him live and in person, and you're only getting this tiny bit of him on a webinar today. But I will tell you that he is a frequent guest speaker at seminars all over the country, especially if you're in Florida. If you have the opportunity to meet him in person, definitely go by his booth, talk to him, because he is just the most amazing person. He and his wife, May, are two of the most beautiful people I've ever had the opportunity to meet. And more than that, I am so excited that I get to call them my friends. So a little bit of it about Dr. Bagnell's background. He's been in clinical practice since 1989. He expanded his practice into functional neurology.
Christy, you're going to let me know when we want to start?
Oh, we're starting. Oh, can you hear me? Michael? Michael, can you hear me? I told y'all we were having issues. Hold on, guys. Better yet.
Can you still hear me? Just testing 1, 2, 3.
Can you hear me?
I hear you now. Yes.
Ah, yay. Okay. Guys, we are live. Forgive me. I'm having issues. Christy's having issues. I told y'all it's the road construction next to my house. It's literally, they're building a road 30 feet from my house.
Oh, my.
Yeah, they weren't doing that when I bought the house. I'm having to come to terms with that. It's having an effect on my internet. The good news is I don't have to have internet for this to work for you guys. So let me quickly tell y'all a little bit about my dear friend, Dr. Michael Bagnell. I am so excited that he's the presenter today. This is not his first time presenting. So if you're interested in going back to look at other classes that he's done on our webinar series, I strongly encourage you to do so in the archive. You can actually search by his name. But he's been in clinical practice since 1989. He expanded his practice into functional neurology, neurofeedback, and hyperbaric medicine, and offers dolphin brain experiences for pediatric and adult clients in South Florida. And Dr. J and I swear we're going to do this with them sometime. We just got to make room in our schedule. We're going to come do the dolphin brain experience. He shares his message around the country for doctors and clinicians on the brain-based healthcare model. And he and his wife, May, one of the most beautiful people inside and out that you will ever meet, host a mentorship and coaching program for doctors with a desire to move their practice into the neuroscience space in 2022. I'm going to post this link to their website in the chat log so you guys can check it out if this is something you're interested in. And I mean, like I said, they're hands down two of the most beautiful people you will ever meet. Like I said, I'm so incredibly lucky and grateful to have had the opportunity to get to know them. And more than that, that they are my friends. So if
That's
you
true.
have the opportunity and you see them at an event somewhere, trust me, go take a moment to say hello, introduce yourself. And Michael, you know what I mean when I say this, but if you ever meet May in like 5 minutes, you feel like your life has completely and utterly changed for the better. I know that's
That's true.
probably, you met her and you were like, this is it for me forever, because that's just the kind of person she is.
Yeah, she is. She is that way. Not so much me, but she is.
You're both beautiful, beautiful people. But I will say, like, there are very few people in my life I've ever met. And I will say that I met her on a really, really, really tough day. And like I said, I will never forget when she leaned over and like just that moment that we met, she changed my life forever.
Wow.
Just beautiful. So anyway,
I'll share that with her. I'll share that with her today. Thank you for saying that.
please do. Well, I'm going to stop gushing about the both of them because they're, like I said, amazing people, and let Dr. Bagnell share his information with you today.
All right. Well, we're going to get rolling here. Gosh, you got me I feel a little sentimental, but actually that's a good place to be for this discussion. And hopefully there's people kind of right here now, but I know there will be some people that will watch it on the taped version or the follow-up later. And so, you're looking at a picture here of architecture for a bridge. And it actually is very apropos for this because we're going to talk about this idea, this quality, this virtue. You can use a number of different terms for it, called empathy. And I have put that it's the key ingredient to your practice growth and your satisfaction. Because when you're involved with people like Christy, who are more than most chiropractors, more than most physicians, committed to the improvement of our profession, I mean, it's pretty remarkable, and we appreciate that, Christy, that you would stand strong and firm and moving us into the future in some things that you're working in, and I'm sure many of your listeners will know that the amount of time, effort that you put in to make our profession better. So when we think about making our profession better, making our practice, growing our practice, well, we're physicians, we're entrepreneurial in a sense, right? We need to have an idea of like, okay, how am I going to improve the delivery of my system, the care for my clients, my patients, and how is my practice going to grow this year, next year? What is it going to look like? Dr. Jay Greenstein will say, how are you going to scale your program? And Dr. Jay is another one of those remarkable people that can help you to do that with many of the things he's developed. And then they built research behind it to make sure that it really is efficacious. So we're going to talk about something more intrinsic, more internal, called empathy today. But those tools that some of these other doctors have will help you in the external aspects of your practice. But this one, empathy, is one that my wife and I say builds from the inside. And you need to build this, well, maybe I shouldn't say you need. You don't need to do anything, but you may choose to start understanding more about empathy because it can build your practice. And there is neuroscientific research based on why empathy is so important. I'm not by nature someone who's that empathetic compared to my wife. My wife is an empath, right? People sometimes call themselves this, and they're an empath. My son is our youngest, who's 28, is an empath. They feel tremendously what other people are dealing with. I'm not so much that way, but what I've come to understand is that it's not just something you're born with. You can actually develop a level of empathy, and it can grow, and you can understand this at a greater level, which can be very beneficial for you internally, psychologically, emotionally, and even better for your practice on many different levels, which I'll show you. So Dr. Helen Riess of Harvard, she is the doc here in the picture that has developed this program that you can actually get to online. I have no disclosures. I make nothing from it, but it's called Empathetics. It's really about the human connection. It's what causes us to connect or to disconnect. What causes us to disconnect, I'm going to talk about. And I'm talking in particular with our patients, but it may also be in your family. And what drives us to connect. You know, now, and it's been this way, people want to be part of something. So they're part of different types of exercise gym programs, right? Whether it's this one F45 or Orange Theory was recently, or it's a yoga student. They want to be part of a community. They want to connect with people, or their synagogue, or their temple, or their mosque, or their church, right? As a Christian, I'm connected to the community of Christians. So this is a very essential component in human beings, the level of empathy that we can connect with people. And we all want to have our needs responded to, especially clients that come to us. They want to know that they're being heard. So if you've been in practice for more than just a handful of years, you know, and you'll hear from patients that another doctor they consulted with spent no time with them. They were in and out with them. Now, let's stop for a minute on chiropractic. Look, I have been in practice for over 32 years. It does not take long to deliver an adjustment. An adjustment is a very powerful tool, if you will, to change the brain, the body, the nervous system, and we have the data as how it does that. It doesn't take long, but it's not about how fast. It's not about how fast. It's how much you can connect, and it's not about how long. You could be with someone for an hour and I wouldn't even know what to say to a patient for an hour and a half or 2 hours. I'm not telling you to do it faster, do it slower. I'm telling you, empathy is not opposed to the chiropractic volume of seeing more people. That's not opposed to that, but you need to find your space. And this is actually a you need. I would say to young doctors, you need to find your level, not your business level, your level to connect with people. Maybe you're very empathetic, very open, and you can do that in just a few minutes because it doesn't take a lot of time. It just takes present time. And that goes back to Dr. Jim Parker. If any of you know Dr. Jim Parker, he would talk about present time consciousness, PTC. Can you really be present with somebody? Listen, my wife and I have been married a long time, and inherently she'll be saying something to me and I'll be, oh, wait. And she's like, just listen to me, right? So, you know, we can practice these things and we can become emotion detectives. And we're going to talk about the neurobiology of empathy. So the top right shows you our center down here in Miami, the Bagnell Brain Center, where we're doing more of a functional neurology model, or another way to say it, chiropractic neurology model, which I've gone back for additional training. And it's what I really enjoy. And I can deliver to people something that I feel is the quality that I want to deliver. And I'm always working on the empathy. I drift away, I work on bringing it back. I drift away, I work on bringing it back. And then actually the environment sometimes will bring you back on its own. So Dr. Helen Riess is there in the bottom. You're going to hear from her in just a few minutes. So what is this thing, empathy versus sympathy? Well, here's a simple idea. Understanding the patient's emotions versus sharing the patient's emotions. You know, you're not going to necessarily share the patient's emotions, but you can understand the patient's emotions perhaps a bit better than you do. And I'm going to just make a general statement that it's been my experience that female DCs, female doctors, tend to be more empathetic in general. There are some that maybe not, than male DCs. And I think if you just kind of considered women versus men, women tend to have a bit more of the empathy gene, maybe if you could call it that. Maybe it's because of the development of motherhood, this built-in system in their physiology, in their psychology, where they learn to reduce the self and focus on the needs of some other people. And we could do with a little dose of that, gentlemen. I mean, it's not such a bad thing. So empathy, to look at it in another way, you can see it on this chart. So pity is at the bottom, right? I'm sorry for you. I pity you, right? Sympathy is coming up the next level. Gosh, I feel for what you're feeling. Maybe you even experienced it with them. You experience the same situation that they have. Maybe you've had low back pain. Maybe you've had terrible sciatic pain, headaches, or neck pain. Yeah, I get that. I know what that's like. But empathy is going up to another level, that I feel with you. Because sympathy might be something that's projecting out, let's just say. And empathy is kind of connecting with where they are. Let me give you an example. How many of you have done report of findings? Every one of us. Report of findings. You put up x-rays or you show them electronically on the screen and you explain to someone, oh, you have a reversed curve here. There's some degeneration between C5 and C6, or maybe it's a pelvic x-ray or an upper cervical x-ray. Whatever the case may be, here's what you have. There's some degenerative changes. The range of motion is lost. You're dealing with pain. We believe this to be the cause. And I just deliver. You see how easy that is. That's 32 and 33 years of delivering that model. That can be done and not even considering the person that's sitting there, how they're feeling about that. Do you know that cervical degeneration probably doesn't really concern us too much, doesn't scare us? We're like, man, that's like, I can do that all day. I can help this person. No problem. Let's get in there. That's a subluxated area. We don't know how that person feels. It's been my experience that most teenagers, when they hear something like that, it freaks them out because they don't understand it. And it's also been my experience that when your level of understanding is low as a patient, the anxiety is high. So the more you can help them understand their condition and what you can do, their anxiety comes down. And so empathy, what are they feeling when I show them these things? I'm in this same situation now with brain-based data and people that are, I would say, for the most part, far more damaged in ways of the clients I see now than the clients I used to see. And they're coming to me for that. So when I see someone with a stroke now, they're coming to me with no other, they've already exhausted the help that they could have gotten. Or I see someone with a child with ADHD and they've been through several different programs, medications, are like, we're at our wits' end. We do not know what to do. Or an autistic child who's moderate to low functioning or on the autism scale, right? Or an Asperger's child whose emotions they just shut down, even though they're a brilliant young person, and they shut down emotionally. And their family says, I just don't know. We don't know what else to do. Counseling, medication, we've been everywhere. So these are the kinds of many times, and concussions. Actually, concussions probably are most common. Post-concussion syndrome. People come in with dizziness and vertigo and POTS, and their blood pressure and heart rate are all over the place, and they feel like their life has been like unplugged. They can't even carry on their normal day-to-day life where they were fine. And I'm going to say things really quickly to them. Oh, well, you have too much alpha here, too much beta there. And so we need to slow ourselves down. And like, maybe not when we're in the room with them, but like now, like, how do I do my report of findings? How does that work with me? Do I ever really kind of slow down and make eye contact with them? And how do you feel about that? How does that make you feel? Maybe that wouldn't be a bad question. But I know that based on some of my own experiences, it's been more of a kind of a routine, my report of findings. But actually, developing empathy helps the communication process and even gives you a level of compassion that you may experience in that moment. And I can tell you, at one point in my career of being more of a high volume practitioner with more than 100 visits a day, not to impress you, but that was not as satisfying to me. In the moment, it seemed like it was, but looking back, not so much, really not so much. And it's not a judgment. It was my experience that the connections with people are really the thing that brings you life compared to what might bring you some satisfaction. It seemed more momentary for me. It seemed like some of the sports accomplishments that I had, that they were really a high and not really not necessarily the level of, oh my word, that really changed that person's life. And so, these are the things of my experience after 30 some years. I feel like I probably have a right to share them with you, right? So empathy. I say, and many doctors say now, it's the critical ingredient. And I'll just read this to you as you're looking at it. Empathy in a clinical context is the physician's ability to understand the patient's emotions. I'm going to pause right there. So you look at this person, you're doing the report of findings, you just said a few things, and you pause. And you look, can I understand their emotions? This has a lot to do with your right hemisphere. You're understanding the emotions of people. Like when they say, and Dr. J says this, can you read the room? Can you read the room and see what's going on? And maybe this isn't the time to drop a joke, or maybe it is. Maybe it's a time to bring in a little levity, like it's going to be fine. You're going to do really well. This is the appropriate care for you. So, being able to read the room, and I'll just go on. This can facilitate more accurate diagnoses and more caring treatment. This differs from sympathy or sharing a patient's emotions, which instead can hinder objective diagnoses and effective treatment. Sometimes empathy leads you to say the harder thing in a gentle way. And that's something I'll share with you in just a minute. So here's some areas of the brain. Some of you may really like this. If you look at the one on the left, and we're looking at a side view, a sagittal, if you will, you all know that. And we can see even in the colorized bottom boxes, regions emphasized by affective empathy tasks. Affective, your mood, your emotions, your limbic areas right there, the anterior cingulate, that's activated. So your emotions get engaged. As a doctor, you can get going, right? In a practice, even if you're not high volume, you're busy and there's things and the next thing, and you have to take care of this, and whether there's therapies and your staff, and how's the marketing going, and what am I doing with the finances, and I got to get that, so you have all these components to the hats that you wear, and you may almost in a way flatten out that emotional connection to these things. I'm not saying to be all over the place with your emotions by far, but to engage your emotions is very important in driving behavior. In fact, it's very good for your dopamine centers, as you can see right there. And so the green area are regions that are shared by cognitive and affective tasks, still in the emotional cortex, the limbic area. And then the blue, regions emphasized by cognitive empathy tasks. What are you going to say? How are you going to say it? What are you hearing? And you can see a lot of it's in the temporal lobe in the middle picture. And that temporal lobe is, what am I hearing from them? And what does it mean? Because we can see that there's Broca's area up near the front, the bluer, then Wernicke's towards that IPL area. And that's how you're gonna understand what they're saying and respond. So we're engaging our emotions, we're listening. It really comes down to good listening skills as a common denominator, I guess you could say. At least that's been my experience. And that's something that is not my strong suit. But you can see there is biology behind this, or in this case, neurobiology. But why empathy? Why? I still want to keep going. Why is this so important, Doc? How can it be the key to my practice? Well, there is research through Dr. Helen Riess's organization that they've done out of Harvard, that they find patients are more satisfied when the doctor or nurse or clinician shows a greater degree of empathy. There is higher reimbursement. You say, how can that be? And less stress. So here we go. Increased patient satisfaction. In 2012, so we're 10 years out, research demonstrated that medical professionals who communicate with empathy have higher patient satisfaction. So how do you build your practice? If you're at all involved with building your practice, you know that everything's electronic and online. Gone are the days of print and handing out print and putting yourself, those things can still be effective, but it's not the majority. The bulk of communication with people for marketing is through electronics. And so if you have a patient that is extremely satisfied with you, like many of your patients will be, and mine have been, they can do a Google review for you. And this moves you up, as you know, the algorithms and all these things, but they are important. They are important in that world. So I even ask patients, it's strange that I would even ask them, they're getting a good response. I'm saying, listen, our team, our marketing team has asked me to ask you personally, would you consider, are you comfortable with doing a Google review for us? Sure, Doc, I'd love to do that. It's been amazing. Okay, do you know how to do that? And if not, then I'll have someone on my staff, she'll walk them through it and they can do it on their device. Or many of the younger clients we have, like, of course I know how to do that. Perfect. So they get that done. And this is a very effective way online, electronically, to build your practice. But you're going to get better satisfaction by practicing and learning empathy. You say, well, how am I going to learn empathy? maybe you're going to sign up for the empathetics course with Dr. Helen Riess. Maybe you're going to do a little reading. There's videos. If you're a YouTuber, you can watch YouTube. There's many videos on empathy and developing that and just taking it to the next level. What about team collaboration? You think you need empathy when working with your office team? I think so. Empathetic clinician communication improves the quality of interactions with others, like patients, their families, colleagues, loved ones. And a key component of the patient experience is the cohesion of the healthcare team and how well they communicate with each other. Listen, how many offices have you been to that the team, or you might say the staff, is just terrible? I mean, zero personable connection with, or reverse, the doctor is horrendous. They are just like totally ADD, zipping in and out, but the team is what makes that practice. So it goes both ways. This is something that can be practiced as a unit. What better way for team building, right? You could do ropes courses, you could do retreats. Maybe you should do those. Those are good things. I've done all that. But working on empathetics together and working through a brief course could be a super valuable thing that could elevate the level of your practice. And you may be able to communicate even better with your team. Now, we know that based on the research, medical malpractice claims are reduced by 82% because by this breakdown. Well, let me say it in a different way. Pardon me. 82% of these medical malpractice claims, and this is medical, it's not inclusive of chiropractic, but you should see it because all these claims are the result of a breakdown in communication according to the data. The communication breaks down somewhere in the patient-doctor care or in the team and patient care. This can include poor physician attitudes, communication failures, disparagement, unrealistic expectations, which have been laid out. So we can reduce malpractice possibilities by practicing empathetics. That's a practice builder. I have been very fortunate never to have had a malpractice case against me. I know a very good orthopedic surgeon, one of the best in South Florida, who had one case. He said it was the most terrible experience he ever went through in his over 40 years in practice. And this gentleman is an excellent orthopedic surgeon. He's an excellent physician and person, father, grandfather. He said it was the worst experience of his life in his professional career. So we don't want to go there, right? And if I could give you something else besides malpractice insurance, is consider where you are on this empathy scale. Are you like me, down in maybe the bottom 50% down? Or are you in the higher 75% and up, like my wife, I would say? She's in that higher scale. So we also improve clinical health outcomes. And this is how empathy can help us, right? Empathetic communication between a clinician and a patient will lead to more engaged healthcare experience. The patient engages more with what your recommendations are, with what you would like them to do. So they have better compliance, right? Better compliance leads to better outcomes. With improved communication, patients experience empathetic care, have better outcomes. Well studied. In addition to adherence, like Dr. J speaks about, and Christy, I hope you'll let him know that we're referencing him many times in here because he's a wealth of information and resources for people. But in addition to adherence to these treatment plans, when medical professionals deliver patient-centered, compassionate care, things get better. You also have reduced clinician burnout. I remember Dr. Chris Petroco-Napoli out of Logan was talking about this several years ago at the FCA. And as she was speaking, we were on the same panel, I recognized, oh man, she's talking about me. She's talking about me. That's how I feel. Burnout happens. And here's what it can look like. I'm just going in, I'm just doing my thing. You just don't have the enjoyment. You're bothered by those little things that people are asking you, your staff, your family, maybe when you come home, the patients, like, oh my gosh, these patients are just, you start feeling like that in like a general way. It's like you feel like the water's rising. This is kind of a burnout feeling, and this is important. So communicating with empathy increases our job satisfaction. This is a practice builder. When you enjoy what you're doing, this reduces burnout, and you enjoy it, and you would like being there, and you deliver something completely different. The increased reimbursement we talk about, metrics have changed for hospitals now to incorporate patient satisfaction ratings. This is like Uber. This is like all these things now. People can rate you, right? So people can put reviews on Facebook, and they can put reviews on Yelp, and they can put reviews on Google. And so that's important, because these ratings may drive people toward you or away from you. You know, we showed some other areas in the brain just before, some of the research data on those slices. But here, it's interesting because this was about watching somebody receive electric shocks. So they had 16 females, and they analyzed this, right? The green areas were receiving, and the watching areas, red, were watching their spouses receive the painful shocks. So it's very interesting that areas of the brain light up when you're receiving them. Of course, sensory motor, sensory areas, limbic areas, but also when you watch somebody receiving that, oh, you feel that. Oh, you feel that in a sense. And I will tell you, you know, I had melanoma on my face several years ago, very severe, very advanced cancer. I got a call from the dermatologist the night that I went, and he said, I don't normally call patients, but I thought you deserve that. This is very serious. The pathology report came back, and we need to have surgery as soon as we can schedule it. So I'm listening on the phone. I'm a little shocked. Well, I wasn't like this. I was holding it like this. And of course, I'm shocked. It's like surreal. Like, what? Like, I just want to let you have cancer, and it's stage 4, and it's melanoma. But this is my cell number, he said. And when we hang up, if you need to call me the rest of the night, it's okay. Just call me up. And this was already at 9 o'clock at night. He's like, no time is too late. Okay, thanks, doc. Appreciate it. And I hung up. I was like shocked, but I also recognized, wow, that's really something. That doctor, he's like, that gentleman took care of me. I trust him inherently as a dermatologist. And I've seen him numerous times since then. I'm doing okay, nothing to worry about. I went through surgery, so forth. But, and he's a little bit quirky, even when I go see him. But I appreciate that guy. And I learned that is a level of empathy. The way he communicated with me. He took care of me, not just the cancer. He was concerned with me. So we can observe people dealing with things, and it can touch us. Or we can block it out. We can become flattened to that. And that's not such a great thing. So Dr. Helen Riess is here. Well, that's what you'll see if you enroll in her courses, and you'll learn much about empathy and how to implement that among you and your staff. But here's a few extracts for you that I want to share with you out of the acronym empathy. It has the eyes are very important. You know, it said in the Bible, it says the eyes are the window to the person's soul. The eyes, or the gaze of somebody, is where you can really understand a little more about them, what's going on inside them. Look at their eyes. So having eye contact is very important. Letting people know, even some of the Native Americans will say that I see you, right? I see you. This thing with, you know, that I understand you, right? I'm feeling you. So your eyes, making eye contact, your muscles of facial expression. It's a roadmap of your emotions. I'm very expressive with my face. It might have to do with my basal ganglia, but some people are a little less expressive. But using the muscles of your expression, your face, and I think they have a kind of a negative term among the ladies where they say a resting something face, which is like you kind of look like you're upset. I think it starts with a B, and it's not beach like in Miami. But, we don't want to have that kind of face. Check your face, see how what are you doing? Ask your spouse, ask your friend. Hey, do you notice that sometimes I look like I'm angry? Because people sometimes do that. They just kind of, their default face is like negative, right? How about your posture? Are you standing? Are you sitting? You cross your arms? What is your posture like with the patient? Are you mirroring them, modeling them to help communicate? How about your affect? What kind of emotions are you expressing? What are you expressing? That's your affect. Your tone of voice. Pardon me. That has a lot to do with your brainstem region. Is your tone of voice monotone? You're constantly here and you're just talking about this and you're just going through the x-ray and the cervical curve and the lordosis is kyphotic and this is degenerate. Are you pausing? Are you looking? Facial expressions, connecting with them? And the tone of your voice can be very comforting. Are you hearing? H, are you hearing them, right? Listen to them. Stop thinking about the next thing you're going to say. Listen to what they're saying for a moment. Sometimes we have to stop people from what they're saying because they're just going on and it's not helping the situation. I learn about that. I have done some mistakes. I've done this one time, right? Like the T sign, time out for a minute. Actually, that's not so bad. Sometimes they chuckle and it startles them. And I'm like, this is, like just for a moment, I want to ask you a question so I can understand better. And they kind of like, oh, no one's ever done that for them. But you better be good at that, though. You don't want to offend somebody. And then finally, the why is your response in responding to them, to their feelings in a mutual way. So that's kind of a helpful hit list for you. Our environment affects our capacity for compassion. Our environment. What is your environment like at your office? What is it like in your adjusting room? In your therapy suite? What is it like in your back office? What is the environment like? I'm going to tell you the killer for empathy. So I gave you the hit list there. I'm going to tell you the killer for empathy. This right here. Time. That's what wipes out empathy in me. When I'm rushed, I'm behind, things are stacking up, first thing that goes is empathy. It's gone. It's like not there. I don't think I'm alone on this. Check yourself. How is it when I get rushed, when I get backed up, when there's 4, 5, 6 people in the reception room, when someone comes in that wasn't on the schedule because we forgot to put that on, or someone comes in that thinks they have an appointment that doesn't, and now you have to deal with that, and they've driven in traffic and they got there. And time is a killer. So managing your time and your book is very important. In my practice, after 33 years, one thing I don't like to have happen, I don't like people to wait. If your appointment is at 3 o'clock, your appointment is at 3 o'clock. I don't like this experience that I've had before, probably you don't either, where your appointment's at 3 somewhere and it's 3:10, 3:20, 3:30, 3:40. I mean, at this point in my life, I'd probably be gone by that. But nobody even comes out to say, we have an emergency. We're so sorry. Is it still good? Do we need to reschedule this for you? How can we take care of you? Is it understanding what's going on with other people and realizing that there's no way in the world we can know everything that's going on with other people. So we offer and we ask and we open to them. This builds your practice. I'm going to tell you, they will say, those people care about me, because this is not the experience in medicine. This is not even the experience in health care. Let me say it that way, because I'm not denigrating allopathic medicine here. This can be the experience in chiropractic offices. Like a mill, how many times have you heard that? It's just in and out. But when your staff and the doctor can be more empathetic, the shortest possible time can feel like such a valuable time. Okay? It's like the old-time medicine. Some of you may be old enough to remember Marcus Welby on television. I always thought that was a great show when I was a kid. He was the doctor that could take care of every single person in the family, and he had time. Empathy is associated with a higher patient satisfaction, better adherence to plan, lower likelihood of mistakes, less and fewer malpractice cases. It even affects the patient outcomes. The research is there. People do better, even in their physical pain levels, and their physiology does better when you empathize. I had a very difficult young man recently. And I would say that his care was getting to a point. It was a post-concussion case with neurological Lyme, depression layered in there. And as we were getting to a point where I could not communicate with this young man from my side, he had almost a bit of a breakdown in the hallway one day where he started to cry, because he'd been to many doctors. No one would listen to him. He didn't feel like he was being understood. I was getting frustrated with it after several weeks of trying, laboring on trying to help him clinically. And I was just getting to the end of my rope, empathetically speaking. As he had that breakdown, I just realized, you know what? That's it. I just need to hug this kid. I just hugged him. I mean, he allowed me to. I could see that it was open to that, and I just hugged him. And I felt like I could have cried too. But I'm going to tell you, that moment was the tipping point in our relationship. He started to get much better over the next few weeks. My level of empathy just exploded. Like I had I think it's in Jerry Maguire. I'm going to reference another silly movie. Jerry Maguire with Tom Cruise, and he says, break down, break through. So you want to have a breakthrough? I'm not saying you have to have a breakdown, but break down some of the things that are holding you back from practicing empathy. It's good for patients. It's good for you. It's good for our profession. It's good all around. There's the empathetics.com website. You can find more information for yourself if that's a good fit. I recommend you check it out at least. And listen, I'm Dr. Mike Bagnell. I appreciate your time. Come and visit us. Give us a call. We're here for brain-based healthcare, which is really what chiropractic is, especially with the empathetic doctors that you are. So thanks for joining us today. Christy, you still with me? I can't hear you, but I'm hoping everything is good.
Michael, can you hear me?
I can now.
Oh, it did it. It worked again. I had to do that 4 or 5 times because my mic went out again.
No problem.
Okay.
Good. We're good?
Yes, we're all good. So that's a wrap. 15 minutes early, everybody. There is no webinar next week because I'm going on vacay.
Woohoo!
Woohoo! I'm going to go get some sunshine with my boys, and then we'll be back, and we'll jump right back into webinars again. So thank you so much, Dr. Bagnell. Give May a big hug for me, please.
My enjoyment. I'm going to share that with her. I appreciate you saying that.
I miss y'all both.
Okay. Bye.